Hi, so today we will be discussing about head and neck cancers. Head and neck cancer is a broad category which includes cancers of sites like oral cavity, voice box, normally called as larynx, our food pipe, that is esophagus, and glands of neck like thyroid and parotid. So all these cancers fall into the category of head and neck cancers. These cancers are one of the most common cancers affecting Indian males and females as well. Many a times people ask that these cancers usually does not happen in females. So this is not true. In India also, the incidence is increasing in females also. And the reason lies behind the causative agents. So what are the main causes of these cancers? There are two main causes. First is tobacco intake in any form, be it smoking, chewing tobacco in form of pan or betel. And the second most common cause is a human papilloma viral infection that leads to more patients in females in India. As these are the main causative agents of these cancers, we can completely prevent these cancers by hitting on these target points. That is, we can completely prevent these cancers by first avoiding tobacco intake in any form, and second, by taking vaccine against human papilloma virus at the correct age of 9 to 11 years. And this vaccine should be given to both boys and girls. Moving on to, if we detect these cancers early, we can completely cure them. So, how we can detect these cancers at an early stage? To detect these cancers at an early stage, we should be aware about the early signs and symptoms of these cancers. So, what are they? The most common symptoms of these cancers are any non-healing ulcer in the oral cavity, any lump or swelling in the neck, any change in the voice in the form of hoarseness, or persistent difficulty in swallowing or eating food or drinking water. If you have any of these symptoms, you should not delay and you should consult your doctor, which can be a sign of cancer. If you consult a doctor for these symptoms, usually we do initial investigations and few investigations to confirm the diagnosis. So to confirm the diagnosis, we need a biopsy. Many a times attendants and patients are worried that a biopsy could lead to spread of this disease. This is a very common myth, and I would like to share in this video that this is a myth. Biopsy does not lead to any spread, and in fact it is a prerequisite for confirming the diagnosis and to proceed with the treatment. After the biopsy, we need few investigations for a staging purpose, which includes CT or an MRI of the local part, and sometimes a PET-CT scan of the whole body to detect any spread. Once the stage is confirmed, then your oncologist will plan for the treatment. Majority of these cancers are completely curable by surgery. In the last few decades, the surgical treatment of these cancers have also improved drastically, and it has moved on from the classical radical surgeries to minimal invasive surgeries in form of transoral robotic surgeries, scarless neck surgeries, and laser surgeries. Also, the reconstruction part has improved a lot, and we are happy to tell you that in majority of cases, now we do reconstruction by free flap skin and bone surgeries. So the final outcome is very good for the patient in terms of functional as well as cosmetic aspects. So to summarize, everyone should be aware about the common early sign and symptoms of these cancers so that we can detect them early. Prevention remains the mainstay. We can completely prevent these cancers by avoiding tobacco and taking vaccine. So let's together fight against this cancer and eradicate this from our population. Thank you.